Hi, my name is Rakia LaVille. I'm a nursing student here at Russell Sage College, class of 2022, and I transferred here from community college back in my hometown. My background is actually in environmental science and youth development, but I decided to be a nurse because I'm passionate about preventative healthcare, patient education, and caring for people who need it. My nursing classmates and I spent a lot of time practicing and refining our skills in one of the four nursing simulation labs on Sage's Troy and Albany campuses. Major gifts from the William Randolph Hearst Foundation have helped Sage furnish the simulation labs with real, high-tech medical equipment, almost exactly what you find in a hospital. I'm here to show you around the newest classroom and simulation lab in Kellas Hall on Sage's Troy campus. It opened in fall 2020. The new space contains an open classroom with seating for 60 and a computer whiteboard, 8 patient bays, and a validation simulation clinical room modeled after a private hospital room. Our patients are 7 high and medium fidelity mannequins, including a pediatric mannequin and a birthing mom mannequin, and 2 auscultation torsos, which we learn to use a stethoscope and listen to the heart and lung sounds. The lab also has a gynecological exam table, 8 portable oxygen suction head walls, and IV pumps. In this footage, you're seeing new nursing fundamentals students who are just learning how to interact with patients. They are in the validation simulation clinical room, set up like a real hospital room in an acute care setting. In this scenario, the patient is flagged with a history of MRSA, a superbug, and requires isolation. Just like in a real hospital, a personal protective equipment cart is outside of the room. The students put on complete PPE before entering what, in today's scenario, is an isolation room. In the room, there is a workable wall unit so we can administer oxygen or suction airways, and a hospital monitor with our patient's vital signs. Today, the patient is one of our high-fidelity mannequins. We call him the SimMan 3G, or Mr. Jarvis. He has lung sounds, heart sounds, abdominal sounds, a pulse, and his chest rises and falls with his breath. He also has a working IV, so we get experience administering IV medications. When we practice performing a physical assessment on this mannequin, we get feedback like we would from a real patient. Usually, 2 student nurses work together on a scenario in this room. Another plays the part of a family member who we interact with as we would in the hospital. It can get intense. Our professors watch and listen to us behind one-way glass. In the patient bay areas, many scenarios may be going on at once with faculty behind portable screens. With faculty out of sight, we learn to use our own critical thinking to solve the problems that arise. Sometimes we have cameras recording us too. Before a scenario, we participate in an S-bar style introduction in the classroom area. Then, we return to the classroom area after a scenario for a debriefing. We watch the recording and talk about what went well and what could be improved. Our professors ask us a lot about our thought processes. The debriefing is the most important part of the simulation for learning. More than 300 students are enrolled in Sage's undergraduate and graduate level nursing programs, and we all spend time in the simulation lab. The scenarios get more complex as we progress in our program. The simulation lab also serves students in Sage's other health sciences programs, especially physical therapy. Thank you for your interest in Russell Sage College's nursing program and its newest nursing simulation labs in Kellas Hall. We look forward to having you visit in person in the near future for an admission event, a professional development event, or for the 100th anniversary celebration for the Russell Sage College Nursing Department in 2022.